In May 2021, Taiwan saw its first major wave of COVID-19 infections. At the time, there were few treatments specifically for this respiratory disease.
We know that vaccination is the most effective means to stop a pandemic. But in the human history, when the virus is widely spread, it's almost impossible to eradicate with vaccination.
Pop singer Nine Chen recalls what it was like to fight the virus.
那段时间其实是，其实对我来讲蛮难熬的，就是喘啊，半夜醒来，然后无法呼吸，我们就透过蔡耿章博士，然后用视讯看诊的方式，开立了清冠1号这样子。第3、第4天开始服用，这样就是早中晚各1包这样子，让我有一个就是有一种抓到一个救命的那个绳子的感觉。
This is Cindy, another COVID-19 patient.
就是还是发烧啊，然后那骨头真的很痛，很像没有希望那种感觉，就有跟我介绍这个清冠1号，要我就是试试看。第2包开始，基本上我的烧退了，就是说觉得舒服，不舒服的状况就改善了，活起来的感觉就比较开怀。
Scientists around the world are working to develop treatments for COVID-19. Taiwan's National Research Institute of Chinese Medicine may have found an answer.
The NRICM-101 is a drug to treat COVID-19, developed in this laboratory by a team of scientists and doctors. Part of its design is to keep SARS-CoV-2 from entering the patient's lungs. To see what it does for the body on the cellular level, a sample is put into a surface plasmon resonance instrument.
病毒上面的spike protein 当作是一把钥匙，那这钥匙会跟肺细胞上面的 ACE2 的受体，那是一把锁，那钥匙跟锁会进行结合，就把病毒带进到我们的肺细胞里面去，我们的仪器会有一个讯号会往上爬，那就表示里面有某一种成分的确会附着在病毒上面的 spike protein。我们的确可以了解说，我们台湾清冠号的成分呢是可以跟病毒上面的 spike protein 呢进行了附着，而阻止了 spike protein 跟肺细胞上面的 ACE2 进行了结合。
The NRICM-101 is a traditional Chinese medicine, an herbal formula comprising 10 different plants, including the Scutellaria root, heartleaf Hutuinia, and Mongolian snake gourd fruit. These 10 herbs are first cooked into an herbal tea, then made into condensed granules. Dr. Sui Zhang is the director of the National Research Institute of Chinese Medicine and oversees the project. He is a physician of both Western medicine and traditional Chinese medicine.
这个处方就包括3部分，第一部分叫抗病毒，第2部分呢是免疫调节、调控的药，不希望它产生细胞激素风暴。那第3个部分就是呢身体支持的在西医叫做支持疗法的这个药物。我们有一个大的团队。
After receiving an emergency use authorization, the formula was commercialized and made available to hospitals.
NRICM-101 showed promising results in lab tests, but clinically, how effective is the formula? We are here to find out. This hospital uses NRICM-101.
This is Taipei Hospital. COVID patients here can opt in on receiving Chinese medicine in parallel to conventional treatment. Dr. Lin Zhongshen is head of the TCM department.
包含了像这个体温、心跳、呼吸速率，还有血压的一些资料。经过一些治疗以后，发现他的这个生命征象慢慢趋于稳定，通常表示这个病人的一些临床状况正在改善，朝好的方向发展。这些临床状况在中医的清冠1号或是其他的这个合并处方介入以后有好转的迹象。
In a small clinical study, researchers found that when NRICM-101 was given to patients, it took an average of 9 days to achieve 3 consecutive negative PCR results. versus 22 days for patients who only received conventional Western medicine.
Since I'm asthmatic and my doctor recommended the herbal mixture called Respirate to help with breathing properly and the cough. And I thought I'd give it a try and started taking it a few days in, morning and night, and it helped tremendously with both the coughing and the shortness of breath.
NRICM 101 is also used around the world as a dietary supplement.
In Taiwan, NRICM 101 is a prescription drug. It has become one of the treatments in the world for COVID-19.